Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. Welcome to this week's episode of Medically Speaking. Our guests today are Dr. Michael Carroll, who specializes in weight loss surgery, otherwise known as bariatric or gastric bypass surgery, and Shannon Wickman, who is the bariatric program manager at SMHC. Shannon and Dr. Carroll, thanks for being on the show.
Hi, thanks.
Thanks for having us.
We like to start off the show by finding out a little bit more about our guests. And so, Dr. Carroll, you are a weight loss surgeon, but you're also a general surgeon. How did you come to specialize in weight loss surgery?
Well, bariatric surgery was a large component of my training in Minneapolis at Hennepin County Medical Center in the late 90s. In private practice as a general surgeon, a large component of my practice is laparoscopic surgery. And as I added more and more laparoscopic procedures, the weight loss surgery was a logical next step. And also I had an interest in, I think it's a good procedure that helps people with their medical complications related to weight. In addition, the hospital here at Southern Maine has a long history of weight loss surgery before I came to town. So they've been performing weight loss surgery here since about 1980, I believe.
And Shannon, how was it you became part of the program, and what was it that drew you to this program?
I started here as the bariatric dietitian for the program, so I would counsel the patients through the stages of their diet. And I got interested in that through wanting to be an outpatient dietitian rather than a clinical dietitian, so really doing more nutritional counseling and lifestyle change. And then I came over to manage the program about 3 years ago.
And Dr. Carroll, how is it that you came to join Southern Maine Healthcare?
Well, actually, growing up in Vermont, I have an affinity for New England, specifically northern New England. And I was a medical student at the University of Vermont, and we spent a large amount of our time in Portland at Maine Medical Center doing rotations. And then I actually did 2 clinical rotations at Southern Maine and learned quite a bit about the hospital. I spent a month with a family practitioner in town, and then a month with a general surgeon in town also, and really enjoyed the area.
How long has the SMHC program been in existence?
Well, we've been performing laparoscopic weight loss surgery since about 1992, and added to the program over those many years, and it's only become stronger as time goes on.
Now, typically, how many patients do you do surgeries on per year?
We're operating on between 30 and 50 patients a year, I would say. Varies from year to year, but.
And how has that changed over time? I imagine you didn't have 50 patients a year in the beginning.
Well, yeah, it kind of varies year to year, and also procedure to procedure. So in the beginning, it was almost strictly gastric bypass. Then we had a period where the lap band was quite popular, and nearly all of our patients were getting lap bands. That's falling largely by the wayside, and the sleeve gastrectomy has come into its own, and now we do a combination of gastric bypass and sleeve gastrectomy.
So can you explain to us how gastric bypass surgery works, and how does it help the patient lose weight and keep the weight off?
Well, gastric bypass has both a restrictive and a malabsorptive component to it. So by restriction, we create a small pouch, and that restricts the amount that someone is able to eat at one time. We bypass a segment of the small bowel, and that decreases absorption of protein and calories. So it's a combination. Whereas the sleeve gastrectomy is just purely a restrictive procedure. We create a tube-like structure from the stomach that restricts the amount that people eat at any one time. Actually, how it works is far more complex than that. There's actually hormonal components to it, but in simple terms, those are 2 of the mechanisms that are at play.
Now, I've heard that you can have a patient come in who is diabetic and on insulin, and when the surgery is over, they're no longer on insulin. Is that correct?
Yeah, that's one of the great benefits of gastric bypass for obese patients with medical complications related to it. It has a high rate of actually curing diabetes and in fact, a durable cure. I would say that's one of the most rewarding aspects of doing bariatric surgery, seeing somebody come in on insulin and leaving the hospital without. It's really quite rewarding.
Now, what's involved if someone decides they want to have gastric bypass surgery? Is it just a question of making an appointment and scheduling it, or what needs to be done to prepare for this surgery?
Well, the first thing is they need to make sure that they qualify for the surgery to be covered by their insurance. So we go by BMI as one of those qualifiers. Someone has to have a BMI, which is a body mass index of above 40 or between 35 and 40 with another qualifying comorbidity. So another condition that their insurance company will feel is related to their weight. The kind of heavy hitters for those comorbidities are diabetes, sleep apnea, hypertension or high blood pressure, and coronary artery disease. So with a BMI of 35 to 40 and one of those conditions, that person can qualify. There are some other qualifiers. We want people to have failed attempts at weight loss. We don't want bariatric surgery to be their first attempt ever at losing weight. And they have to be ready. So our program has a 6-month average preoperative component where we're really working them up. We're having them work with our dietitian and our behavioral health specialist to make the diet and lifestyle changes that they'll really need to make to be successful long term after surgery. So that's a big part of our program. We offer support groups, counseling to the patient and to their families, because we're asking them to make a lot of changes. If they don't, they may or may not be successful after surgery long term.
So what I think I'm hearing you say is that this surgery isn't necessarily a magic bullet cure for these things. It sounds like the patient has to be very involved long term if they want this to be successful. And because of this, the pre-work that you have to do, does that make this program more successful than others?
It's hard to compare with other programs, but we get kind of the national averages, and we do have a high success rate that compares favorably with that. And we have patients who will come back to us for the long term, and that's kind of our clue that they feel like they're getting good care and that they've made this a lifelong change.
Can you give us some examples of patients that you've worked with who've made these big changes and what their lives are like today?
Yeah, one of our patients who we talk about at every informational session is he's a great success story. He started the program at about 360 pounds, took medication for diabetes and high blood pressure. He lost 60 pounds on his own in the 6 months prior to his surgery through making these diet and lifestyle changes. Then he lost an additional 100 pounds since his surgery. He's about 4 years out now, and he no longer takes medication for diabetes or high blood pressure. He's run several half marathons, and he still comes back to our support groups and kind of pays it forward, giving people his advice and sharing his successes and his struggles, because he does still encounter them at 4 years post-op. So he's one of our great successes.
Now, Dr. Carroll, I know there's always risks with surgery. Is gastric bypass surgery more dangerous than other types of surgery? What are some of the risk factors that someone who might be thinking about this would want to think about?
Yeah, I think any surgery should not be taken lightly, and that's why we spend a lot of time evaluating people before the operation to make sure that they are appropriate and ready to go through the procedure. But when you compare risk of this procedure to other more commonly performed procedures, such as even removal of the appendix or gallbladder or a hernia repair, weight loss surgery actually compares quite favorably. It's a overall safe procedure, and it's certainly less risky than staying obese. People are at greater risk by maintaining a high weight long term.
Now, how long does the surgery typically take, and what's the hospital stay afterward and the recovery time? What does that look like?
Yeah, so the procedure itself takes between 1 and 2 hours in most cases. They're out of the hospital either the next day or the day after. Everybody's a little different. And then they're on light duty activity at home. They can get back to work, light duty activity whenever they feel up to it. Can't drive while they're on narcotic pain medications. And once they're off that, they're free to be about. No heavy lifting for a couple weeks before I see them in the office and follow up.
So when someone has got a BMI of 40 or above, is it possible to achieve the weight loss just through exercise and diet?
It is possible. It's not impossible, but I think that the data says that it's less than 1% of people, once you get that BMI over 40, who are able to lose weight through diet and exercise alone and keep it off long term. I think it's less than 1%. So once we're reaching these BMI levels of 40 and above, surgery is the best option for helping an individual lose weight and maintain that weight loss long term. And that's not to say that diet and exercise aren't a huge component of that success. The surgery really is a tool for helping diet and exercise be the other tool to get someone there.
Now, I know some of the older surgeries that aren't done anymore, you would remove part of the stomach so that if someone wanted to reverse the procedure, that wasn't possible. With the new techniques, the sleeve procedure, is it also permanent? I mean, is this something, for whatever reason, if somebody wanted to change, is it possible to go back after the surgery?
Well, I encourage anybody who going through weight loss surgery to think of it as irreversible. A gastric bypass procedure, all the parts are still there. I could put you back together. It would actually be more hazardous than the original surgery. With a sleeve gastrectomy, there is a section of the stomach which is removed, so making it truly irreversible. You're not going to grow another one back. You're not going to get a stomach transplant. But I encourage people to think of both of these procedures as irreversible.
Now, I know you have two procedures. We've talked a little bit about the sleeve procedure. Can you talk a little bit about the other procedure, and when would you choose one procedure over the other?
Yeah, the sleeve gastrectomy is where we resect the outer portion, what we call the greater curve of the stomach, and create a tube-like structure, which is a high-pressure zone, and creates what we call satiety, the feeling of fullness, that restriction that decreases the amount that people eat at any one period of time. The decision between the two, in a large number of cases, either would be appropriate. When people ask me which one, I say either. Either one will put them in a better state than staying obese. There are some differences, and that's really handled on a case-by-case basis. By and large, diabetes is better handled with a gastric bypass. People who have had a large amount of prior abdominal surgery might be more appropriate for a sleeve gastrectomy. But it's really something that I sit down with each patient and go through. In many cases, either of the two procedures would be appropriate.
You're listening to Medically Speaking, and today we're speaking with Dr. Michael Carroll, weight loss surgeon at SMHC, and Shannon Wickman, SMHC Bariatric Program Manager. And we'll be right back with more of our program right after this.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back. We're talking weight loss surgery with Michael Carroll and Shannon Wickman from the SMHC Bariatric Program. Now, what's the motivating factor for somebody taking the step to actually going to the weight loss surgery and all the things that are associated with that?
It's really got to be improving their quality of life. If someone's coming in and wants to have the surgery to fit into a smaller size clothing or to look good on the beach, that's usually not enough of a factor to make it through the program and be successful long term. What we like to see is someone with a long list of medications, dwindle that down to just the vitamins that they'll take for the rest of their life. People can play with their kids, they can ride on an airplane, they can get back into physical activities that they previously enjoyed. Those are the type of motivating factors that we like to see that really make it so someone's going to be successful long term.
Now, you've mentioned support groups and having former patients come in and talk to candidates for the weight loss surgery. Because I would imagine there's a psychological component that people are not always eating because they're hungry, they're eating for other reasons. Do you find that these support groups help people deal with these issues that cause them to overeat?
Yeah, our support groups are really one of our most robust parts of our program. We offer them once a month, and they're a mixture of pre-ops, people waiting to have surgery, and people who have had surgery anywhere from a week ago to 15 years ago. So they're all coming together and kind of sharing their struggles and their successes. And they're led by myself, Chelsea, our other dietitian, and Devin, who's our behavioral health therapist. And that's really one of the issues that we tackle a lot, is this idea of head hunger versus physical hunger. People come into the program, they think, oh, I just need to get to my surgery and everything will be fixed. I'll think and feel like a thinner person and it will be easy. And that's really not the case. So we want to tackle those things and make sure that there are appropriate coping skills before surgery, because if they're not in place before surgery, it's hard to develop them after surgery.
So it sounds like it's really a lifelong commitment when people decide that they're going to go ahead with this.
Yes, it is.
So can you tell us a bit about the nutritional support that's offered to patients? I imagine if you're consuming less food, there's more of an emphasis on the nutrients that the body needs, and that you need to be more conscious of eating the right foods that give you the right nutrition.
Yeah, the nutrition part of it is huge for a patient's success. The surgeries limit the amount that you can eat, so what you do put in has to really be exactly what you need. It has to be good quality, it has to be protein first. And then there's a malabsorptive component to the bypass, which means that some of the foods that you eat, you're not absorbing everything from them in the first place, which is why that lifelong supplementation is crucial. The changes for bariatric surgery for nutrition are much different than other, say, diets that a person may have tried before they come to us. For example, some diets really are volume-based, fill up on a broth-based soup and a large salad before your meal comes so you can eat less of that. That's completely the opposite of what we're telling our patients to do, because they're going to fill up after a few bites, so they really have to know what to eat and how to eat it. They have to eat slow and chew thoroughly and make sure that what they're eating is what their body really needs. And that's part of that 6+ months of work that we do before surgery.
So what are some of the greatest challenges that face the patient entering the program? And are there any barriers to their success?
Well, they have to be ready. If they're not ready for the surgery, they have to at least be ready to embark on a program that's going to ask them to make a lot of changes and to commit to those visits. I mean, we work them up. We do tests that some patients come and maybe haven't seen a doctor in years, and we want to make sure they're in the best shape to have surgery, both physically and emotionally. So if someone is not able to keep appointments, if someone is reluctant to make those diet and lifestyle changes that we've talked about, they just might not be ready. And that's usually the biggest barrier, is someone realizing that the things we're asking them to do are too much for them at this time.
I think that's true, Shannon. I think in the end, my effect on them, the surgery itself, lessens as time goes on. And if they don't really embrace the lifestyle and diet changes that you try to teach them before the surgery and after, they're bound for failure. But the people that do make those changes really have great success.
Can you give me some examples of things that people should definitely not do when they're approaching this program?
Yeah, there are some things that are specific to success with a bariatric surgery. One of the things we ask our patients to do is to separate drinking from eating, and that's a difficult challenge, but it is something that lifelong they'll need to do to be successful. Another thing is avoiding carbonated beverages. That extra air incorporated into the GI tract can make it difficult for a patient. Focusing on protein first. And if they are currently smoking, to quit, and that's got to be a lifelong habit.
Now, smoking is bad for your overall health, of course. Why smoking, though, specifically for the weight loss surgery?
Smoking increases the risk of our patients developing ulcers after surgery, and it's very difficult for those ulcers to heal.
Have you ever had any patients gain the weight back? And if they do, how do you help them get back on track?
Yes, we definitely have had patients who gain weight back, and I think we've all heard stories of patients who gain all of their weight plus more back. And it's something that there are programs that will do revisional surgeries, for example, taking out a band and converting it to a bypass, something like that. We don't do that in our program, but we really stress that our counseling components of the program are available to the patient lifelong. So our first line of defense would be to get them hooked back up with our dietitian and our mental health professional.
Now, there have been some high-profile cases of people in the news who have gone through the surgery. Do you find that there's an increase in interest in the surgery because of that?
Yeah, I think so. I think it's good that the high-profile people are talking about it. It kind of reduces the stigma around surgery, and it generates interest.
So why should someone choose SMHC's weight loss program? There's others out there, of course. What makes yours special?
Yeah, I think one of the strengths of our program is that it's a small program, and that patients are in direct contact with Shannon, with Chelsea, with Devin, with myself, and can remain in contact with us long term. I think that's one of the strengths. Another is that it is run by Shannon and largely Chelsea, who are registered dietitians. So nutrition is a large component of this whole process.
Well, we're an accredited program, so we're accredited by the MBSA QIP, which is really the credentialing body that accredits quality bariatric programs across the country. And that was a rigorous accreditation to receive. It's hospital-wide, so through a site visit, so a surgeon comes and really looks at our program from start to finish. Every person and provider that a bariatric patient would come across in their journey is evaluated. So we're proud of that accreditation as well.
Now, how can our listeners find out more about SMHC's weight loss program?
So they can always call our program, but the first step to really get into the program is to attend one of our free informational sessions. Those are held once a month in Biddeford and once a month in Sanford. Dr. Carroll speaks and I speak. Chelsea and Devin speak. We explain our program, the surgeries that we're doing, and if a patient likes what they hear, then they get an application at that time. That's the first step to get in, and then they'll need a referral from their primary care to progress from there.
So is there information on the website, the SMHC website, or is there a phone number people can call to find out this information?
Yes, the number and the schedules for the information sessions are on our website, along with more information on the surgeries and about our program in general at www.smhc.org.
Now, where are your patients coming from? What communities locally are you finding people are coming to you for treatment?
Well, as a percentage of patients, the largest would be the Biddeford-Saco area, along with Sanford, Springvale. But we see patients coming from throughout York County, but also neighboring counties, Cumberland, Oxford, and also New Hampshire. We see a number of patients from eastern New Hampshire.
Now, Shannon, I think you mentioned that you do need a referral to enter your program. Does that usually come from the primary care physician? Where do you see most of your patients coming from?
Yeah, the primary care physicians are a great source of support for our patients. No matter what, when a patient goes to their primary care, if that primary care says, I think this is a good idea, that can kind of be the cementing piece for someone who may have been contemplating, should I do this? So it's nice to have the backing of a primary care provider who believes in surgery and has seen other patients be successful with it.
Well, Dr. Michael Carroll and Shannon Wickman, thank you for coming down to the show, and it's great to get all this information out there. If people want to know more, they can, of course, go to smhc.org, and they can find out all about the weight loss program. So thanks again for appearing on the show.
Thanks for having us.
Thanks very much, Robert. Thanks for having us.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.